Every week, I see patients that are just overwhelmed. They're being sold on the latest device, the latest miracle treatment, and they just don't know what's real and what's just marketing. Today, I want to give you clarity. I'm going to share the in-office treatments I actually like. Treatments that are safe, time-tested, and effective when used the right way. Hi everyone, I'm Dr. Shim Ching, board-certified plastic surgeon here in Hawaii. I specialize in facial rejuvenation, which means making people look as young as they feel without looking overdone or artificial. Last week, we talked about the treatments I consider overhyped and not worth your money. This week, we're focusing on the opposite, the procedures I actually believe in and actually belong in a smart anti-aging strategy. Things that improve skin quality, boost collagen, and keep you looking fresh. I'll cover what they do, who they help, when to use them, so you can avoid wasting your money or running into any problems. Think of this as your honest guide to what's worth keeping around. Before we even get to the in-office stuff, I need to set the foundation for you. Because the truth is this, the daily things you do are more important than the occasional treatments you buy. It's like fitness. You don't get in shape from a 1-week boot camp. You get in shape from what you do consistently, your diet and exercise. Then use boot camps to accelerate progress. Skin is the same. So the foundation is two things. First is sun protection. If you're not protecting yourself from UVA and UVB, none of this really matters. Sun is responsible for about 70 to 80% of visible skin aging, wrinkles, thinning, discoloration, brown spots, broken capillaries, not to mention skin cancer. Daily, broad spectrum sunscreen is non-negotiable. Hats, shade, UPF clothing also will help you. Number 2 is active skincare. Things like retinol, vitamin C, niacinamide, peptides, hyaluronic acid, barrier lipids, pigment inhibitors. That's your daily fuel that keeps collagen production going and pigment production under control. In my own practice, I've combined these into simplified systems so that patients can stay consistent. But whatever products you choose, it has to include those building blocks. Otherwise, you'll spend thousands on treatments and undo them in a few months. So treatment number 1, let's start with microneedling. This one is a workhorse. The tiny little needles create controlled micro injuries in your skin, which trigger your body's natural healing cascade and stimulates collagen production. Why do I like it? Because it addresses exactly what aging skin loses, collagen and elasticity. It's great for fine lines, texture issues, acne scars, and especially areas like the neck, where the skin is thinner and more delicate. The key is a series and consistency. It's not a one and done. I recommend 3 to 5 sessions spaced 4 to 6 weeks apart, then maintenance every few months. Here's a quick story. One of my patients in her late 40s came in with early crepiness on her neck. We set her up with daily sunscreen, retinol, plus a microneedling series. By the 3rd session, her neck looked smoother, more youthful, and she didn't feel the need to cover it up with makeup anymore. That's the power of collagen stimulation. It doesn't show overnight, but it builds real strength in the skin. Treatment number 2 is microneedling and PRP. Now let's make microneedling even better. We add something called PRP, which is platelet-rich plasma. We draw your own blood, we spin it down and separate it, and we use a serum that's rich in platelet growth factors. After microneedling, we apply PRP over the skin so it seeps into those tiny little channels created by the needles. So why does this matter? Growth factors amplify the body's healing response and lead to even more stronger collagen stimulation. I find it especially useful for the neck and the chest and acne scars, places where we want extra collagen production without a lot of downtime. It's a natural boost. You're using your own biology, your own blood, no foreign substance, just your body's ability to heal itself, but supercharged. Next up is treatment number 3, RF microneedling. This one can be controversial, so let's clarify. Used shallowly within 0.5 to 1.5 millimeters, RF microneedling is fantastic for improving skin texture, pores, and fine lines. The heat plus the injury gives a stronger collagen response than just microneedling. You can go too deep though, so be careful when you get this treatment because if you go too deep, you can have complications that can lead to problems. So keep this treatment shallow in the skin, and it's a great option. Treatment number 4 are chemical peels. I've been a big fan of chemical peels for years. They're simple, they're affordable, and they are effective. Light peels like glycolic, salicylic, Gessner's, or low-strength TCA remove the outer layers of dead skin. They improve pigmentation, they soften fine lines, and reveal smoother, brighter skin. They're great in a series every 4 to 6 weeks. Medium peels will go deeper and can really reset skin that's sun damaged or etched with lines. They come with more downtime though, but in the right patient, they're very powerful. What I love about peels is that they're predictable. You know what you're getting, and you see the improvement. The only caveat is darker skin needs experienced providers to avoid any pigmentation or any issues afterwards. The bottom line is this: when they're planned carefully, peels are one of the most reliable tools for improving your skin quality. Treatment number 5 are lasers. Lasers are a huge category, so let's break it down into 2. Non-ablative light treatments, IPL, BBL, these are best for pigment and redness, sunspots, broken capillaries, that blotchy look. These treatments can clear them beautifully. Usually you need a series of treatments, but when paired with good skincare that suppresses pigment production, results can last much longer. One caution is if you have melasma, IPL, BBL can actually make it worse. For melasma, we focus on skincare and very precise lasers that can work very well for that. Ablative resurfacing, such as erbium or fractionated CO2. This is for wrinkles and texture, especially that stubborn upper lip area, crepey cheeks and neck, and overall dullness of the skin. These all have great results. It's still downtime though. If you're red, peeling, and swollen for a week or 2, the payoff is that you're gonna have great, younger looking skin afterwards. In my opinion, these lasers, when combined with solid skincare, can buy you years of improvement. Treatment number 6 are neuromodulators: Botox, Dysport, Xeomin, Daxxify. Let's talk about these. They've been around for decades, studied endlessly, and they really do work. What they do is relax muscles in the face, and they prevent what we call dynamic wrinkles from becoming static, etched-in wrinkles. Typical areas are the forehead, the frown lines right here, the crow's feet. We also do things like make the lips a little bit larger. These are all very good targets for Botox. If you use it regularly every 3 to 4 months, it'll keep your skin smoother, prevent those deep creases from forming in your face, and in experienced hands, they don't have to freeze you and make you look artificial. You can still have some expression, just without the heavy lines, and you look refreshed. I've been using Botox personally for years, my wife as well. It's safe, it's effective, and still one of the best bang for your buck treatments in aesthetics. Number 7 are fillers, which you really need to use wisely. This is an area where style matters, and I'm not against fillers. I'm against using them to replace surgery. Where do I like fillers? Small targeted areas, like your lips, the temples, the chin for balance, the cheekbones. Fine etched lines work very well to fill with a little bit of filler. Touch under the eyes in the right patient actually can make somebody look a lot more youthful and get rid of what look like eye bags. But where do I want to avoid them? Stuffing the cheeks or filling like the jawlines and making them look very obvious. Or trying to lift a sagging face with just too much filler. That leads to distortion, artificial look, and the dreaded pillow face. So fillers are a tool, not a cure-all. When used conservatively, they're great. But when they're used aggressively, they make people look unnatural. Treatment number 8, facials and hydrofacials. I'm a big fan of our great estheticians here. Regular exfoliation, pore cleansing, hydration, they all keep skin healthier and enhance results of your actives and in-office procedures. Hydrofacial in particular, great, nice luxury treatment. Vacuum cleansing, a mild peel, serum infusion, hydration, all with 0 downtime. This is great before your important event. This is great for monthly maintenance as well. Just remember though, facials are maintenance, not transformation. Pair them with actives and occasional bigger treatments for real anti-aging staying power. So let's step back. Here's how it all fits together. Daily non-negotiables are sunscreen, retinol, vitamin C, other supportive active skincare. You want to supplement that with some serious work, such as microneedling with or without PRP, peels, non-ablative light therapy, and remember, these are skin tools. When it comes to sagging jowls, loose necks, heavy eyelids, surgery is the right answer. But these in-office treatments keep your skin healthy, glowing, and youthful, and they complement everything else beautifully. So if this was helpful, make sure you subscribe. I post weekly videos breaking down skin and facial rejuvenation so you can make smart choices. Drop your questions in the comments, I read them all. So thanks for listening, Dr. Shim Ching. Take care of your skin every day and it will take care of you for decades.